Ms. Dr. Kiki Kwok talked about an increase of 30%. I would like to get a clarification because the Commission on Insurance have recently done a survey, and in 2013 it's actually 32%. Please verify the figure and supplement the information. Well, under your proposal, there is a standardization of plans and coverage. An expansion of coverage is, of course, a good thing for consumers. And when it comes to premium, the consultant said it's going to be about 3,600. But there is a variance or margin of error. There is a margin of variation. In one of the meetings, we talked about this. The 3,600 is plus or minus 45%. If you refer to page 58, that is those between 45 to 49, the consultant said it's $4,750 when it comes to premium. And there is an increase of 6% in premium. So in 2017, we're talking about $6,300. With the variation, that is an increase of 45%, we're talking about $9,124 in premium. I think your theory is very different from those of members. Well, because some members don't want to see anything about a subsidy. But currently in the public sector, there is a subsidy of 97%. And for those with high risk, if they pay $10,000 or $20,000, it's not a subsidy. I don't understand why these members say things like that. Perhaps they're suffering from a constipation in their brain. Of course, there needs to be risk sharing. You have to have young and healthy people in the market. If you rely solely on subsidy, it doesn't work. Well, the original proposal is $50 billion. Say, for example, a 30% discount on the first take-up, and then also 30% off when it comes to a long patronage. So you will save about $1,000. So it's very different from a save of just several $100s in tax. So there is a problem of sustainability. If you can attract healthy and young people to take up policies, of course there will be risk sharing. And healthy people will become unhealthy, and young people will become old. You have generations of young people to make it sustainable. But there is well, since it's not mandatory, then there is no incentive for people to keep joining. In a radio show, Dr. Louis Shi said that, well, this proposal will not be sustainable. So I wonder whether it is indeed sustainable, the proposal itself. And that itself is a problem. I have a lot of questions to ask, but I would like to focus on this. Well, originally we had $50 billion. You didn't have to go and ask for it. And this is part and parcel to the health insurance scheme, to control private sector, to enhance fees transparency, and also to subsidize the premium and the use of $50 billion. But there is no more information in this regard. How can you ensure sustainability? When it comes to subsidy, well, of course, I don't want to see people say that whenever there is subsidy, then there's a subsidy of the private sector. Well, there is a high subsidy rate in public sector. If more people can go to the private sector, then it will make available capacity in the public sector to serve more people. So don't see subsidy as something that is negative. And of course, when it comes to premium, we have to attract younger people. And we've been saying that we don't just attract high-risk people. We have to have the high-risk pool because we have to deal with this before we can make insurers accept the high-risk people. When it comes to incentive, we have to look at quality. I think Mr. Chan's question is why don't you use the $50 billion and a 30% premium discount? We've heard a lot of views that they don't want to see direct subsidy from the government. So if we use tax deduction is one of the ways, and it's not taking money directly from the 50 billion. And if we use tax deductions, perhaps you may say that at the beginning the annual amount will be small, but it will snowball and the amount will increase. And we have to attract healthy people. And quality is very important. There are a lot of people who are ill, but they are healthy, comparatively speaking. And because they're suffering from certain conditions, they are unable to take out policies.
So these are not the people of highest risk. So we must not discuss only the extreme cases. Some are with many illnesses and some are all healthy. Now there are many in the middle class. They have the financial ability to buy insurance, but they couldn't buy it.
The major objection is that the FSB should not impose too many restrictions. In Singapore, well, without competition, well, perhaps there will be a lot of products, and healthy people will not choose certain products. And if you want to use the $50 billion in offering discounts, then, well, for those who meet minimum requirement, there will be discounts. And as a result, there is competition, and you can attract young and healthy people to take out policies. I remember in the meeting, Secretary, you said we pointed out to you that if you went ahead, then some people who are unable to take out certain products, they were forced to go back to the public hospital. We have compiled some statistics. We see that in Hong Kong we have done a survey on 1.8 million policy holders. Those who are paying under 2,000, 27%, between 2000 2005, 13%, 2005 to 3,000, 11%. So about 80,000 people are paying a premium of under 3,000 at 2013 prices. If you do not change your strategy, hundreds of thousands or even millions of people will not be able to take out a policy anymore. Well, they cannot afford to pay the premium. And if they can't pay the premium, then they will go to the public sector. And this is contrary to the objective of your proposal. So I hope that, Secretary, you will have a detailed discussion with the sector. We will listen to the facts. We've reached a stage, just like constitutional reform, is whether to go ahead or not. Please make final adjustments to make it acceptable. We have had discussions with you over a number of years. At the beginning, we were at loggerheads and we made concessions. We think the 12 areas are 12 requirements are okay because there is no limitation on pricing. Well, if the public knows about the high premium and they accept it, there is no problem. Then why do you just make people take out policies that meet minimum requirement? You can teach the public through publicity and education. That will be effective. You have to maintain free market here. There is no insurance product that has been regulated by the government. for product, maybe you have to meet certain requirements of the, say, SFC, say, for example, disclosure, no misleading information. That itself is important. Well, I've been arguing with the DS, with the PS and the Secretary for a long time. Out of the 1.5 million, half of the people are paying a low premium. So how are you going to deal with this? You're a responsible government. I hope we can exchange views and we can work out a proposal that will benefit everyone. As I said at the outset, coverage, protection, we have an idea. If members decide to veto this, because there is a certain limit of subsidy, albeit a high-risk group, well, we have considered doing it voluntarily to meet the minimum requirement. We think that the standardization is the best part of the proposal. Any response from the Secretary?
No, we can get further data from Mr. Chen, and we will continue to communicate with Mr. Chen and industry.